Good afternoon, and thank you to Dr. Tedros, the Director General of the World Health Organization, for this opportunity to acknowledge and thank all midwives all around the world for everything that they do. This is a very special International Day of the Midwife, as it is, of course, taking place in a very special year, 2020, the International Year of the Nurse and the Midwife. When I first became president of the Save the Children some 50 years ago, much of their work revolved around maternal and child health care, provided by midwives, who also trained local midwives and traditional birth attendants. Their impact on reducing infant, child, and maternal deaths was remarkable. The impact of their work should never be forgotten, as it will always be relevant. I have the privilege, as patron of the Royal College of Midwives in the UK, of visiting maternity units across the country and meeting women, their families, and the midwives who accompany them throughout their pregnancy, childbirth, and those early days of parenthood. But I also see midwives accompany women throughout their reproductive lives, including in much more difficult times, through miscarriages or through the grief if their baby does not survive. What I see at first hand is midwives with exceptional professionalism in a uniquely demanding and caring role, and a lasting, trusting relationship between midwives and women and their families. Because pregnancy is not an illness, but pregnant women may become patients if something goes wrong. And this is why the 2020 International Year of the Midwife campaign of Midwives with Women by the International Confederation of Midwives is so relevant, and why we are so fortunate in the UK to have such outstanding midwives. As the UK's National Midwifery Association, the Royal College of Midwives plays a critical role in ensuring midwives are trained, supported in their professional development, and legally protected in the work that they do. This did not come about by chance, but through the strong and articulate campaigning of women such as Zephyrina Vich to ensure that midwives were recognised as professionals. And this professionalism, enshrined in law only at the start of the last century, is what underpins midwifery practice in the UK. That professionalism extends beyond the borders of the UK. I am impressed with the international work that the Royal College of Midwives does, for example, to strengthen quality midwifery care through supporting midwifery associations in countries such as Cambodia, Bangladesh, Nepal, and Uganda. More recently, the Royal College of Midwives has developed a strong partnership with the World Health Organization through its support to the Ministry of Health and Family Welfare in India. Together, they are providing support to assist the government of India to introduce a cadre of professional midwives. A huge undertaking, but one that is needed and will make a significant difference in India. As patron of the Royal College of Midwives, I'm also pleased at the collaborative work being carried out by the International Confederation of Midwives with the WHO, the UN Population Fund, and UNICEF, and other partners to ensure that midwives globally are educated to international standards and are legally enabled to provide the full scope of care that midwives can provide. Today is a special day for midwives globally, as the unique International Day of the Midwife. However, we must not ignore the outstanding role that midwives are playing in this global coronavirus pandemic. Every day, everywhere, babies are still being born, and midwives continue to smile and manage their own risk to make sure that women and their newborns stay safe, survive, and thrive. For centuries, midwives have guided and supported women, their newborns, and their families through the most exciting and sometimes perilous of times. I'm so pleased that this global event is taking place to truly celebrate the work of midwives globally.